Hello everyone. In the video நம்ம multiple endocrine neoplasias பத்தி பார்க்கலாம். Shorta you can call it as MEN syndromes. All these MEN syndromes are autosomal dominant in nature and it can involve any endocrine organs. So என்னென்ன involvement இருக்கலாம்னா it can involve the pituitary gland, it can involve the parathyroid gland, it can involve the thyroid gland, the pancreas and it can also involve the adrenal gland. So எல்லா MEN syndromeலயும் எல்லா glands involve ஆகாது. Totally there are 4 types of MEN syndromes. So one by one பார்க்கலாம். The first one is the MEN1 syndrome. So MEN1 we can also call it as Werner syndrome, and Werner syndrome we should not confuse with Werner syndrome, which is associated with progeria due to helicase deficiency. So this one is Werner syndrome and the gene involved is menin gene, which is present in chromosome number 11. So moon main endocrine organs நம்ம remember பண்ணணும். So these are remembered by 3 P's. The first one is the pituitary, second one is the parathyroid, and the third one is the pancreas. அதுலேயும் ஸ்பெசிஃபிக்காக endocrine pancreas. So pituitary gland it can cause adenoma, which is mostly a prolactinoma. So they can have galactorrhea, amenorrhea, sexual dysfunction. And parathyroid பொறுத்த வரைக்கும் they can have adenoma more than hyperplasia. So most in MEN syndrome it is going to be an adenoma, and in the adenoma it's going to produce excess of parathyroid hormone, which is the primary hyperparathyroidism. Adanala it can lead to hypercalcemia, and the most common symptom of hypercalcemia is fatigability. In pancreas it can cause gastrinoma more than insulinoma. What is the overall most common cause of endocrine pancreatic tumor? Abdina it is insulinoma, but in MEN1 syndrome it is gastrinoma. Next, MEN2A, it is also called as Sippel syndrome. The gene involved is RIT gene, which is present in chromosome number 10. So it can involve the adrenal gland, the parathyroid gland, and also the thyroid gland. So adrenal gland it is going to produce pheochromocytoma, which is usually bilateral in nature, and in parathyroid gland, same like MEN1, it is going to produce adenoma more than hyperplasia, and in thyroid gland it is going to produce medullary carcinoma of thyroid. In medullary carcinoma HNE பார்த்தோம்னா there is going to be accumulation of amyloid. அது என்ன type of amyloid na? It is the A-cal amyloid. The tumor marker is calcitonin. Next நம்ம MEN2B syndrome பத்தி பார்க்கலாம். It is also called as MEN3 syndrome, and the gene involved same தான் RET. It is a RET gene in the chromosome number 10. So the easier நம்ம வந்து 1P plus 5M அப்படின்னு ஞாபகம் வச்சுக்கலாம். The first 1P அப்படின்னா it is the pheochromocytoma, and remaining 5 வந்து M. ஒன்னொன்னா பார்க்கலாம். The first one is the medullary carcinoma of thyroid. இது ஆல்ரெடி நம்ம MEN2A பார்த்தோம். So next one, the marphonoid habitus and mucosal ganglioneuromas, mediulated corneal nerve fibers, megacolon. So these are the 1P plus 5M symptoms of MEN2B. And MEN4 abdina, it is also called as MENX, and the gene involved is CDKN1B, which will produce P27, which is a cell cycle inhibitor, and the chromosome involved is chromosome number 12. So MEN4 syndrome there is going to be presence of pituitary adenoma, parathyroid adenoma, pheochromocytoma, and genitourinary tumors. So there can be tumors involving gonads and kidney. We have 4 MEN syndromes: MEN1, MEN2A, MEN2B, which is also called as MEN3, and MEN4. MEN1 syndrome, there is defect in menin gene, which is present in chromosome number 11. MEN2A and 2B there is defect in RET gene, which is present in chromosome number 10. And MEN4 syndrome there is defect in CDKN1B gene, which is present in chromosome number 12. So MEN1 syndrome, it is also called as Werner syndrome. It involves 3 P's. First P is the pituitary. Pituitary we have the prolactinoma, and in pancreas we have gastrinoma, and in parathyroid we have parathyroid adenoma. MEN2A, it is also called as the Sippel syndrome. Sippel syndrome there are 2 P's plus 1 M. The 2 P என்னன்னா it is the parathyroid adenoma and pheochromocytoma, and in the 1M is the medullary carcinoma of thyroid. Next, in MEN3 syndrome, we have 1P plus 5M. 1P it is the pheochromocytoma, and 5M synonymous, it is the medullary carcinoma of thyroid, Marfan habitus, mucosal ganglioneuromas, medullary corneal nerve fibers, and megacolon. In MEN4 syndrome, there is features of MEN1 syndrome along with genitourinary tumors. So this is all about the MEN syndromes. Thank you.